have a lot of nurses in this room who are caring for geriatric patients. So it's for all who love senior people and then who care for geriatrics. And Nepal is one such country which is trying, moving ahead, establishing the foundations of caring for geriatricians. Today, I will be traveling in a little bit, going out of Kathmandu, so I don't have a prepared speech as such. What I'm going to speak is from my heart. And speaking from heart begins with my work in the Ministry of Health several years ago when I was working with our colleague here. That was around 2006, 7, 8, 9, 10, when I was secretary in the Ministry of Health. We have a very senior doctor, himself 102 years old now, Dr. Gauri Shankar Lal Das. I hope you had an opportunity to meet him. If you haven't, you must meet him. He's remarkable. And he used to come to Ministry of Health and say, let's do something. And then there are colleagues, I don't see them here, the civil society people. And there was an NGO from the UK. It was called Connect for Change. So together, they came to my office one day, and they said, oh, could we do something? And my brother is a geriatrician working in the UK, in Aberdeen. So I wrote to him, and then when he had come, I took him to show a hospital that has just recently been built, but not occupied. I thought maybe we could develop that as a geriatric hospital. But then when I went to see that, it has beautiful operating theaters and other accessories. So we said, oh no, this has to be something special. So we developed that into the transplant center now, and it's functioning very well. But that was a consideration. But I had to do something. So I said, okay, let me put some money in the budget so at least Patton Hospital could have few geriatric beds, and they did. And now, currently, after more than a decade, almost 2 decades now, I am so happy to learn that at least 61 hospitals in Nepal already have geriatric beds. There are more than 10 doctors who are trained as geriatric specialists, geriatric nurses trained as care for geriatricians. The elderly people. Nepal's policies is very friendly to our senior citizens. Unfortunately, the resource constraints that we have at all levels, that really we lag far behind in what we should be doing and we could be doing, but the interest is there and the policies are there. You may know that the Nepal's population is 30 million now, and 10 point something of that population is senior citizens, geriatrics population. So we really need to work for them. So what does the government of Nepal do for these people? I would say, in a way, very little, because people are still, not receiving the care they need, but in a way, a lot. For a country with low socioeconomic status, we give them monthly allowances, and then we have some social support programs for them. We have health insurance for them. The hospitals and other facilities have, like a line. There's a lot of long queue here for patients. It's not like abroad, you come with an appointment and you spend 15 minutes with the doctor. No, we have waiting time of hours and queue of hundreds. But in that, senior citizens get a specialized kind of queue, which again shouldn't be there, but it is. That's the situation we have. And then discounts in medicine, discounts in many other things, including travel and so forth. So for a country with low economic status, I think we are trying our best to cater to the senior citizens. But why is the health of senior citizens so important? That's because they are going to be the bulk of the population in a couple of years. And unfortunately, the younger people who should be there caring for them, they are getting fewer. Our birth rates are going down. Our people of young age, they are seeking opportunities abroad. So there's a dearth of young people who could be looking after our senior citizens. And also in Nepal and in many Asian countries, I'm sure even in Pacific, we had a beautiful joint family system where grandparents, parents, the grandchildren all live together. Grandchildren would play in the lap of grandmothers and fathers, and then they would hold their hands to go for walks, and they would keep asking questions, getting answers, learning things, and enjoying life and growing up, learning cultures and traditions. But now sadly, we've copied the West, so we have a nuclear family, both parents working, and then the kids are in a nursery or at home scrolling through their Facebook pages, which is a really sad thing to happen. And all of us in this room, I think, we are the ones who are saying that is not right and we should set it right. So I request every one of us who's in this room today to make a vow to ourselves that from any place we are, wherever we are, be it teachers, be it social workers, be it nurses, doctors, we need to work to change the situation. So how do we do that? By encouraging families coming together, by promoting healthy aging. So the senior citizens who are in this country, at least they have, independence. If there's no one to take care of them, they should be able to take care of themselves. So how do they do that? Is by being active, healthy, eating well, and our people, whenever they go to visit parents, they think it's good to give them a lot of sweets. But then they should be eating healthy, greens, fruits, balanced diet, nuts, and exercise, holding hands, talking to them, keeping their mind active. We had a very renowned poet in Nepal, who used to play cards, and the neighbors used to come to his house to play cards with him. Mero Kiran Naksabko buaka naam ke re? Madhav Gimire, yes, thank you. And the neighbors used to come and play cards with him, and he passed away at the age, I think, of 102. Until his last date, he was writing beautiful kavya, we call it, the best of the best books in literature. And he was such a loved poet. So why that happened is because his mind was kept young by his family, by his friends, and by the young people who were in the community who would say, can we play with you? And then they would come and they would trick him to remember the cards which were played. So simple things you can do, each of us can do in our homes to keep the health of the senior citizen happy. So now, I think I've already said what needs to be said. My tenure is short. I'm here just for 4 months until we hold a new election. And whoever comes as the new minister, I would like to do something meaningful, which is like a change in our policies. Some of us, need to create positions for geriatricians in Nepal, which we don't have yet. They are working under the position of general physicians. We don't have specialist nurses. So all those positions have to be created. And just recently, I've gotten permission to do an ONM, we call it, Organizational Management Survey, which allows us to create some positions. So let me see if there's any flexibility of at least creating a few positions so that you can, serve as a specialist that you deserve to do. And many of our partners, there's vice chancellors are sitting out there at the back. I didn't see you earlier. The partners, like the UN agencies, WHO and others who have supported us and continue to support us, I think they deserve a special vote of thanks. And UNFPA has specially worked for females, And then because they are population agency, they are the ones who help us do our population strategies and population policies. And in the population policy, which was revised just last year, there's lots of things for senior citizens, and we need to prioritize some of them. And our ministry is Ministry of Health and Population. Currently, my team members are in various provinces of Nepal, orienting the provincial ministries about what is written in the population policy and how we should make policies which are, supportive to our senior citizens and various age groups, and especially to the marginalized section of the society. Because in our society, there are women primarily, but men too, based on several kinds of discrimination, be it economic, be it caste, be it, the geographic kind of remoteness. So everything brings challenges to our communities, and I think we should together address all these issues as much as we can. So I wish all success to this conference. And Dr. Umesh Bogatti, congratulations to you for having this event here, and for every one of you who have joined this meeting, to wish him luck so that together we can be a champion for this cause. And hopefully in the years to come, when we meet, I don't know, in Indonesia or wherever next time, we have results to show that following this conference, we presented so many papers, we took so many lessons learned, and we have made so many changes, and here are the results. Even if it's a little bit of change, if the change is in the positive direction, we would have achieved a lot. So I wish you all the best, and thank you for coming over to Nepal. And I can see many other guests at the back. Welcome to Nepal. As you can see, it's a beautiful country, and very hospitable people. I'm sure you'll have a great time. Do enjoy our hospitality, and maybe we'll meet somewhere sometime. So thank you all so much.